Have you been kicked out of your bedroom because you snore too loudly? Or maybe you're just tired of having your bed partner nudge you and tell you to roll over because you're snoring too loudly? I'm Dr. Hamilton Stubbs. Welcome to my YouTube channel. If you haven't subscribed, please do so. I'd love to have you. I want to talk to you about obstructive sleep apnea syndrome, one of the most common sleep disorders that we see. I'm a board-certified sleep specialist and I'm a nutrition specialist. Don't forget to subscribe to the channel and hit the notification button. If I say something that you like, give me a thumbs up. And if you know someone who could use this information, please feel free to share the video. So what is obstructive sleep apnea syndrome? It is the reversible, complete, or partial closure of the upper airway. The upper airway starts at the tip of the nostrils and goes down to the top of the windpipe. And you can tell where it is just by feeling on your own neck, and you feel this bony cartilage. So at the very top of that, that's the end of your upper airway. The cartilage in your neck keeps that part from collapsing. Now, the nostrils don't collapse, but you do get problems that can cause some obstruction. For example, when you get a cold, or if you have problems with allergies, you can develop nasal polyps, and probably the most serious obstruction could be caused by a tumor. If you've ever had a broken nose, sometimes the septum comes back, reconstructs, but it does it and it's crooked or deviated. And this could make it hard for you to breathe, especially when you're sleeping and you're experiencing the normal physiology of circulation in the nostrils. So it affects women just as much as men when women reach menopause, but prior to that, it mostly affects men. It is associated with excess body weight. About 75% of people with obstructive sleep apnea syndrome have obesity or extra body weight, but 25% of people do not have a problem with being overweight. Yes, it does tend to run in families. That could be because of the shape of the skull or the facial features. It also tends to be more common in African Americans, but it affects all races or ethnicities. And it happens a lot in congenital defects that affect the face. So children who have Down syndrome, or if you have a short chin, like a Pierre-Robin syndrome, or if you just have crowding of your teeth, even if you had those corrected at some point in your life, if they had to pull teeth, that's an indication that the jaw is probably small. You can tell if your jaw is too small for your tongue just by opening up your mouth, look at your tongue, and see if you have those ridges on the side of your tongue. Those go along with your tongue pushing up against your teeth because your tongue doesn't have enough room. So why is that significant? When you go to sleep at night and your muscles relax, the tongue can fall backwards and block your airway. It affects all ages. Children, even infants, can have obstructive sleep apnea syndrome, but the problem becomes more frequent as we get older. So how do you know if you have this problem? You can go to my website and just click the link to get access to an online questionnaire. But the symptoms are divided into daytime symptoms and nighttime symptoms. So daytime symptoms include waking up feeling as if you never had a good night's sleep or you didn't go to sleep, even if you've been in bed for 7 or 8 hours or long enough to have slept and been refreshed. You may find that you're a little irritable. Things that used to not bother you so much, they start to really make you irritable and cranky. You can also have problems with fatigue. And this means that some people are drinking way too many caffeinated beverages. They are self-medicating with caffeine. The other thing is it affects your memory. It could make you have little difficulty concentrating. And in young children, it can be confused with attention deficit disorder. So these people do not need a stimulant. They really need to have the airway evaluated and treatment for obstructive sleep apnea syndrome if they're found to have obstructive sleep apnea syndrome. Now, the nighttime symptoms are most commonly snoring. The snoring doesn't have to be very loud, but some people do snore loud enough to wake themselves up. But it's usually the bed partner who's complaining about the snoring and telling you to move over onto your side. And what that does is it opens up the airway because it redistributes the pull of gravity so that your tongue is no longer falling into the back of your airway. You can also have problems with waking up frequently during the night. Usually this is to go to the bathroom. You can also have difficulty falling asleep or staying asleep. And here's something that's very interesting. You can have a recurring nightmare. It's like a dream of not being able to breathe, or someone choking you or chasing you, or difficulty catching your breath. And this is thought to be because of a partial arousal that occurs because you've closed off your airway. So what's the treatment? The most common treatment is a positive airway pressure machine, and this is where you wear a mask over the nose and mouth, or maybe just over the nose, and the machine pushes air into the airway so that you have an air splint holding everything open. Now, I don't recommend positive airway pressure therapy if I don't have to for younger people because younger people have such an active life and we're looking at years of needing treatment. So those patients may do better with an oral appliance or even upper airway surgery. If the symptoms, if the obstructive sleep apnea is very mild and there's a history of allergies, treating the allergies might help get rid of the problem with obstructive sleep apnea. Now, we usually do the initial study at home, and sometimes we can't get as much data as if you went into the sleep lab. But if we can document that your sleep disturbance or cutting off the airway only happens when you're sleeping on your back, you might be a candidate for position therapy. There's other ways to treat it, including a surgical implant that sends a stimulation to your tongue and causes the tongue to move out of the way if the airway is closing down. The other thing is losing weight. Now, you don't have a guarantee that if you lose weight, your sleep apnea will go away. But if you're above your ideal body weight, there are many chronic diseases associated with extra body weight, so it would be in your best interest to try to lose some weight. The fatty tissue is considered to be an endocrine gland now. In the past, we used to think it was just extra body tissue, but we know that it's inflammatory and it's actually classified as an endocrine gland. So that's a little bit about obstructive sleep apnea syndrome, who gets it, why it happens, and how it's treated. If you elect to just ignore your obstructive sleep apnea problem, you could be at risk for heart attacks and strokes. Sometimes over a period of time, it will change the structure of your brain and give you a pattern that is consistent with a form of dementia. It's also been associated with unstable moods. For example, if you tend toward depression, it could be more difficult for your health provider to control your depression if you have uncontrolled obstructive sleep apnea syndrome. It's also associated with elevated blood sugars, so it can make you have too high of a blood sugar level. and it's been associated with changes in your liver consistent with fatty liver. Also, when you don't sleep well, you can get an imbalance in your hormones that control your appetite, your leptin and your ghrelin. So it could be difficult for you to stick to your weight loss diet if these hormones or neuropeptides are not in balance. So I hope this helps you understand obstructive sleep apnea syndrome. If you like the video, give me a thumbs up. Don't forget to share. And if you haven't already subscribed, subscribe to my YouTube channel. Love to have you.